Paco from Zinpro, and we will talk about some potential problems of lameness that can be partially solved through nutrition. The first one is the weakness of one-old-age chicks in terms of lameness due to the findings of this paper in 2013 coming from Israel. Here you can see that according to the days of incubation, the level of reserves in the egg yolk sac of 4 different minerals, phosphorus, iron, zinc and copper, dropped dramatically, especially after day 11, and this is due to the fast development of the skeletal system in the embryos. So the solution to that should be to provide a good source of zinc, manganese, copper and iron, and to have good care of the level of phosphorus in the first week of life of the chicken. And by doing that, we can reduce dramatically the problems in the first half of life of the chicken. Another problem we see today is related to the big size of the breast of the broilers, because that makes the center of gravity be displaced to the front, so that the animals really have to walk at the end of the growing period like ducks. And that puts a lot of mechanical pressure in this joint, which is the intertarsal or hock, as well as in this joint, which is the stifle or the femorotibial. So we have to make all we can to reinforce the structures of cartilage, tendons and ligaments, as well as the bones. Related to this problem of mechanical pressure, we have perhaps the biggest reason for lameness in broilers and turkeys, which is the bacterial chondronecrosis with osteomyelitis or BCO. This problem consists of 2 steps. In the first steps, we have a stressful situation in which there is an increase in the permeability of 2 crucial tissues, the respiratory tract and the intestinal mucosa. Through these 2 monolayer epithelial tissues, bacteria translocate due to the stress, translocate inside the blood, and through the blood they can reach very distal portions of our body. One of them is this weak point in the long bones between the articular cartilage, which is white, and the growth cartilage, which is gray, because between these 2 tissues there are very little interconnections, either vascular connections or connective tissue connections. That means when the animal is heavy enough after day 35, these tissues tend to separate and to create microfractures. To complicate things more, in this area the capillary network is fenestrated, so there are big holes through which the bacteria can easily translocate and induce an inflammatory reaction in these microfractures that will destroy the tissues, giving way to the BCO. Here you can see some example in the head of the femur. This is a healthy head of the femur in which we can see the white articular cartilage that is then decapsulated later on. There is an abrasion of the tissue, and conforming the progression advances of the problem, we have complete destruction, hollowing out, and complete decapsulation of the head of the femur. And it can happen in vivo, so it can be very painful. Something very similar happens in the head of the tibia, with complete destruction of the trabecular bone, and that makes that when we hang the broilers in the shackles in the processing plant, we can induce spontaneous fractures just because of that. And we can think mistakenly that this is a problem of calcium and phosphorus, which is not. The good news is that we have demonstrated with Dr. Whiteman from the University of Arkansas, and this is the work if you want to look for it. You can reduce, in this stressful model in which you put the animals after day 35, a reduction in lameness levels from a day 42 of 55%. So 55% less animals lame. And even at day 56, when the animals really are heavy, we can reduce 29%. So can we achieve that with all the minerals? In this case, we are talking about zinc, manganese and copper as one amino acid, one metal complex from Zinpro. And the trick consists in producing a complex of one amino acid and one metal, in which the metal shares a couple of electrons with the group amino and the carboxylic group of the amino acid, so that when this complex reaches the enterocyte in the intestine, the enterocyte will allow the penetration of this complex through the amino acid channel and not through the normal inorganic cations metal transporter channel, which is very easily saturated, and there is a lot of competition between minerals to take the right protein to be a transporter. Thank you very much for your interest, and I hope it is useful for you.